Hello, I am Gail Greiner-Weinstein, and welcome to my DNP Scholarly Project presentation, Implementing an Interprofessional Human Trafficking Protocol in the Emergency Department, an Evidence-Based Quality Improvement Initiative. Human trafficking is a global health crisis with millions of victims and many negative health effects, both physically and mentally, on the victims. The trafficking victims present in emergency departments with red flags, indicators physical, mental, and trauma as examples. Because of these, it was necessary to develop, deliver, and evaluate an interprofessional education program to screen, intervene, and appropriately refer, implement an ED human trafficking protocol using standards developed by the National Human Trafficking Resource Center and the Joint Commission. In the literature review, it was found that there were hospital emergency departments identifying trafficking victims by screening tools, and that the intervention used could be as familiar and routine to the healthcare providers as interviewing and caring for the victims. The emergency department was found to be an excellent place to do this. Theories used to support this project were making sure a grounded theory of watching over and surveillance that nurses do on a daily basis when caring for their patients, and re-aim, reach, efficacy, adoption, implementation, and maintenance. The emergency department at the hospital used for this project showed on a needs assessment that it had a practice gap with no current human trafficking screening, intervention, or referral protocol. The project plan was to develop, implement, and evaluate the success of the education of the nurses and social workers in the emergency department, as well as the development, implementation, and evaluation of a protocol for the identification, treatment, and appropriate referral of human trafficking victims. Their documentation was also evaluated for completeness and protocol adherence. This was a quality improvement initiative measuring the effects of an education module and EMR documentation protocol. The project was done in a community hospital with participants, the emergency department nurses and social workers, a single convenience sample, non-randomized cohort, and the emergency department patients meeting a positive red flag item on the human trafficking screening tool. The project timeline: in 2019, the education module and protocol was launched, and in 2020, data collection and evaluation occurred. This project was IRB exempt by Loyola University. The education module for evaluation was evaluated using 10 multiple choice questions composed of education module content. The content validity was measured by an expert panel. Chromebox Alpha was used for measuring internal consistency, and a paired sample t-test for differences in pre- and post-test results was used. Program evaluation was done with non-parametric descriptive statistics and a Likert rating scale. Human trafficking protocol documentation evaluation was done with non-parametric statistics. Compliance with the protocol and documentation were monitored in the EMR. The results: using a reliable and valid Likert scale tool in the pre- and post-test demonstrated that 84.5% of nurses and 100% of social workers felt they had learned the material and would use the material in their practice. Program evaluation: 85% of nurses and 100% of social workers had an 88% ability to identify an at-risk population, and 82% of nurses and 89% of social workers demonstrated that the education met their personal and professional expectations, and they would apply this to their practice. 91% were able to describe the negative health effects of trafficking. Protocol EMR data: we had a number of 16,607 emergency department patient charts over a 6-month period. They were reviewed, and of those, 27% were identified as being positive for red flags for human trafficking. Upon further review of criteria of diagnosis and chief complaint, 22.22% of the patients met the criteria. After further analysis of the identified inclusion criteria, no patient met the criteria for human trafficking. While age was identified as excluding a patient, ethnicity and gender were not found to be risk factors, and patients over the age of 53 were excluded as potential victims also. Implications for practice. The emergency department healthcare team play a vital role in recognizing and responding to healthcare needs of victims. Nurses and social workers are many times the only healthcare practitioners to recognize, intervene, and provide referral resources. Development and implementation of an education module for nurses and social workers is an efficient and effective way to provide education about human trafficking. The revision of the EMR to include a human trafficking protocol provides a standard mechanism for documentation. Please see the references listed on the lower right-hand side. There are quite a few. Thank you, and have a nice day.